standing section. There's not, but Margarita or Clara can sit up here and look over.
We're all experts at their but
And then just remember, stop broadcasting. So you want me to stand right here?
Yes.
We'll let you, yeah.
You're gonna, I mean, we can see you.
Well, no, because this is full screen,
You'll
so
be in.
I
you'll be in
assume
there.
it's the, it's all yours, sir.
Well, this is a first for me to speak to a small crowd on this, but to do so in a way that I guess mimics there being a large crowd since it's being live streamed. My name is Robert Parham, and like so many different fields, when we look at mental health in particular, there are people who specialize in certain things. And what can happen a lot of times is you get so locked into your particular area of specialty that you may neglect, other areas that very much relate to the work that you do. And that is certainly true for me. My primary focus in my practice is with sexual behavior problems. Everything from, kids who are acting out in sexual ways that are not normative, all the way up to adults who have committed sex crimes and everything in between. Having said that, one of the areas that I also specialize in is working with teenagers, and I've done so for quite a long time, about 21 years. And some time ago, I became particularly interested in, at the time, what we referred to, and I think a lot of people still do, as Asperger's syndrome. And it happened basically by accident. I was working for an agency, had an Asperger's syndrome client. I didn't know a whole lot about the disorder, and so I had to learn. And it was a particularly challenging case because of, in this case, the repetitive behavior was one that was going to get him locked up. It was illegal what he was doing, which was exposing himself in public. But he just couldn't stop it. And that's why. It's because he neurologically was locked in to this behavior. And so it was a very challenging case that necessitated a lot of reading and going to training if I could find it in my area, doing the best I could. But that's how it started. So over the years, that ended up becoming one area in which I brought in my practice in the community. So my emphasis for this talk, when I was asked to come and speak last week on healthy sexuality, it does kind of come from a background in working with teenagers who have been diagnosed with Asperger's syndrome, but who have been engaging in some type of problematic sexual behavior. And some of them have been arrested and who come to the attention of the courts and community mental health agency because of a sexual crime that they've committed. Now, having said that, I'm not going to emphasize that. I just want to talk in general about healthy sexuality and, as it applies to people who are on the autism spectrum. I don't know that I want to spend too much time on this, and I apologize for how small the print is, but there has been some change in the Diagnostic and Statistical Manual of Mental Disorders regarding how to diagnose and what the name of the actual diagnosis is. We've come through a period of transition where it was thought that some of these disorders that are on the spectrum were very distinct disorders. And so the general consensus at this time is that they're not that distinct, that they're all on the spectrum. And so the new edition of the DSM, the DSM-5, does rename those disorders as the autism spectrum disorder versus having autistic disorder as a separate entity from Asperger's syndrome, from a pervasive developmental disorder, NOS, kind of the diagnosis. One of the key factors in differentiating those spectrum disorders is in terms of severity. So, next. Go ahead. There are some specifiers about whether or not there's intellectual impairment. We know that, for most people who are classically Asperger's syndrome, there really aren't, significant numbers of intellectual impairments. There's normal, average intelligence, in some cases, superior intelligence even, at least as measured, by our standard ways of assessing intelligence. And then also language impairment, which again, may or may not be a key feature for someone who's more in the Asperger's range. But the differentiation has been in terms of the severity level of the impairments. And so we're talking about social communication and restricted repetitive behaviors primarily, where you make a determination about just how severe the impairment is in terms of verbal and nonverbal social communication skills, or in the inflexibility of behavior, difficulty coping with change, some of those factors. So there's 3 levels of severity. So that was just to kind of highlight that there have been some, pretty significant changes as far as what we're calling the issue. Now, I know that there's also a feeling among people about labels, and I have a tendency to try to use language that will communicate across many different domains, but I'm also aware that my own preference would be to say that a person who is on the spectrum is not someone who you should think of as they're disordered. They're a disordered person. That would be a shame in a lot of different ways because of how stigmatizing it can be. I am a neurotypical person. Okay, so they're just not typical in terms of their neurocognitive abilities. So when it comes to sexual development, the one key piece of this whole presentation that I want to make sure gets expressed is that people who are on the autism spectrum are no different than people who are not on the autism spectrum when it comes to how they develop sexually as far as the physical development is concerned. Okay, they're also not really, in a lot of ways, not very different in terms of values and beliefs because of where those come from. The differences are going to be in terms of emotional and social development and how that impacts overall sexual development. So it's just important, just like with any person with sexual development and how you help them to develop sexually as a human being. When it comes to physical development, you're going to focus on the standard things that you would with anybody: sexual anatomy, growth and development, the reproductive system, hormonal changes that take place, sexual responsivity, both psychological and physiological sexual responsivity, and also birth control, safe sex practices in pregnancy. These are all just standard parts of sexual education kind of curriculum. It's no different from someone who's on the spectrum. They need all this information as well. Emotional sexual development. Just like most people, you have to address feelings, attitudes and beliefs, self-image, body image, emotional expression, and intimacy. social sexual development. You know, there's a lot of learned behavior when it comes to how we socialize, and that is also true with sexual relationships. Culture has an influence, friendships, peer influences, peer pressure, but there's also legal boundaries. Our society has set up, you know, legal boundaries that you cannot cross or there will be consequences. We all have to learn what those are. And then also what the expectations are for courtship, dating. The influence of values and beliefs on sexual development. Everything from religion to family traditions to culture, community, socioeconomic status even, ethnicity, and disability. All of these things have an impact on and influence our values and our beliefs about sexuality. Most people, I think, are aware of SICUS. Okay, so this is, in my opinion, the premier go-to online resource for sexual development, sexuality curriculum. Okay, and there's just a wonderful, exhaustive list of resources that you can download from their website. So I always point everybody to that website. So having said that, people on the autism spectrum are really no different than anyone else in terms of their needs in sexual development. We do have to pay very close attention to where there are special considerations, okay? And that's going back to that social and emotional component of development. So with socialization, you know, we're talking about developing competence, you know, the abilities and skills, but also the confidence in social abilities. This is a very challenging area for people on the spectrum, but it's an area of development that we all face. Creating opportunities to observe, develop, and engage in appropriate social and sexual behavior. So much of what we learn growing up, and especially in middle school and high school, is based on what we're observing and experiencing with our friends and our peers in school. So because people on the spectrum tend to have some significant difficulties with their social interactions, developing age-appropriate friendships, this may not happen to them. Developing hobbies and participating in extracurricular activities that foster growth in the area of social competence through trial and error without damaging self-esteem. That's the key, without damaging self-esteem. One of the things that we know about people who are on the spectrum is that once they hit adolescence, there tends to be a sharp increase in the amount of depression that people on the spectrum experience. And one of the key factors in the development of depression is they very much want to have friends and to be social, but they may lack the skills to do so effectively. And that's when low self-esteem, depression, and shame starts to build for them. Potential problems, and kind of already outlined this a little bit, is the lack of opportunity for appropriate sexual expression, ignorance of what actually is considered appropriate. That word is difficult because what's appropriate to some may not be appropriate to others based on a lot of those other values and beliefs that were in the previous slide, and where you derive those cultural differences, religious differences, and the like. Opportunities for privacy may be less frequent for some individuals. You know, there are some people who are on the spectrum, depending on their severity level, that aren't really allowed to have as much privacy as a neurotypical person would. Withholding comprehensive sexuality education. That's a travesty. You know, a lot of parents in particular, if they're not really educated about their children in this area, have great fears and a lot of reluctance in terms of educating their child about sexuality. Inappropriate, problematic, and illegal sexual expression is also an area of potential problem. So about that, the inappropriate, problematic, or illegal sexual expression, there are three kind of key areas to consider. One is the public-private kind of errors that are made. What is a public expression versus what should be kept private? A couple of examples of where this can be a problem is self-stimulation, or even masturbation in a public setting, versus knowing that this is a behavior that you can only do in private, or saying something that's inappropriate in public. These are things that most kids, as they age and develop, tend to kind of pick up on. They learn from experience and from their environment and their peers, but it may be lost. Some of these things may be lost on a person who's on the spectrum. Stranger friend errors. Okay? When can I hug and who and at what time? Even if I want to hug. And that's a whole nother issue too, because there are some people on the spectrum with sensory sensitivities who may not tolerate physical affection very well. But there can be mixed messages. Observing two people at school, a boy walking up to a girl and hugging and giving them a kiss, might be translated as an appropriate social behavior, depending on, again, the severity level of the person on the spectrum. So if they then take that example and mirror it, it could get them into big trouble. This is another area where it's gone down a lot, but I remember when I was in school, there was a certain age where boys started to engage in some inappropriate behaviors with girls, from the things that they would say to them to even ways in which they would touch them. And it was unwanted and it was abusive. If those kinds of things happen, today, which I do think it's gone down quite a bit, but it still happens. And the person on the spectrum observes that behavior, they're at high risk of engaging in those same behaviors if this has not been explained to them in detail, that it's not okay. Developmental and age difference errors. Okay, so one of the things that can happen for a person on the spectrum in terms of social interactions is that because same age peers may not fully understand and appreciate where that person is coming from, they may view them as odd or different in a way that ostracizes the person. Okay. Well, they very much want to have friends. So what can happen is they can gravitate towards younger kids who will not reject them, who will actually look up to them and seek them out because they enjoy the attention of older kids. Okay, and there's nothing inherently wrong with that. However, it can create a situation for the person on the spectrum where their familiarity and their comfort with this younger kid, when it comes time for their hormones to kick in and they're having sexual thoughts and feelings, they may not understand that that child is completely off limits in terms of any sexual exploration. For the average 10, 11, 12-year-old who goes and spends the night with their buddy to engage in sex play with each other out of sexual curiosity is very normal. Okay? But a person on the spectrum may not have that opportunity. And so if they are with, most of the time, younger kids as their playmates, there's a risk. Back to the public-private errors. What we have to do is we have to teach behaviors according to what is appropriate in public versus private. This is very tedious work because there's a lot. Many errors are basically just a result of confusion on the person's part, a lack of awareness. Sometimes it is just limited judgment or poor judgment. We certainly need to discourage um, them from engaging in these activities in public, exposing their private parts, scratching or touching their genitals. And I'm talking about things beyond like the baseball player on the baseball field who's adjusting himself, okay? And certainly from self-stimulation in public. Masturbation. Okay, masturbation is a normal, natural, non-harmful behavior. It can be a way of learning to be more comfortable with and or enjoying one's sexuality by getting to know one's body. Okay, this is a normal behavior. Masturbation is a private behavior, however, okay, and it's inappropriate in public places. Adolescents and adults need to know how to masturbate in a way that is responsible, healthy, and legal. Okay? Responsible and healthy includes, how do you masturbate in a way that is not going to result in injury to yourself. Okay? This is also an area where you have to be careful, of course, because you wouldn't want masturbation to become one of those repetitive, narrow focused behaviors, okay? Where the person's masturbating multiple times a day, every day. So you do have to set limits and restrictions around that.
That's the thing, one thing, I'm a foster parent and that always comes up in foster parent training, and you get people in foster parent training that really think it's a bad thing, but compared to all the other choices, it's a very good thing. But then they talk about foster kids who do it in public. That's one of the examples of training. But then you hear people that talk about, how much is too much, when does it become
A problem.
or like a compulsive behavior.
Yeah.
And
Well, I can tell you that in general, there's not like a very specific number or frequency. They can say that's been optimal or anything like that. Everywhere from not at all to once a day is pretty normal, and everything in between. Okay, masturbation can be used not just for what I've already mentioned in terms of getting to know yourself sexually, to understand your body better, but masturbation can also be great for stress relief. Okay? I would say that if the person's masturbating more than once a day, they're too preoccupied with that, or they're using it to cope too much. They're using too much as a coping mechanism, and they need to develop other skills to cope. But the whole, how to masturbate can be problematic. I mean, how do you teach a kid how to masturbate? Where's the line with what you should or shouldn't do in teaching that? And
not getting arrested.
Exactly. So my point of view is that you don't literally show them how to masturbate, but you do in graphic detail explain to them how you do it. Okay. There's not for juveniles, okay, but there's actually a video that was produced that obviously you can only use with persons who are 18 or over in this country. That is a very graphic and detailed visual training tool, if you will, for how to masturbate to do so appropriately. And I'm blanking on the name of it. Maybe it'll come to me later. But things like very specific details, like using lubrication, can be very important. Because a child may actually hurt themselves while they masturbate if they're not using lubrication. And I want to go back to, I don't want to ignore the fact, because I brought it up earlier, different influences. And one of those is cultural, one of those is religious, okay? And so those can be very huge challenges and barriers in dealing with things like masturbation if your religious beliefs tell you that masturbation is a sin, okay? And and the worst thing you can do, though, is to teach a child who is masturbating, that they should be ashamed of themselves for doing so. Especially someone who's on the spectrum who really may not have that much control over that behavior. What are you doing to them when you instill in their mind that this is a bad, sinful, behavior, and yet I can't stop myself from doing it? With stranger friend errors, most people I think who work at all, and parents certainly who've educated themselves know about using the circles kind of approach to teaching about social relationships and boundaries. Where you've got the small circle in the middle is where you are, and there's only certain people like your mother and father, or your brother or sister, or your girlfriend or boyfriend, who's in that circle, and then you kind of outline what kinds of behaviors are okay. And even there are some differences. It may be okay for you to kiss your girlfriend on the mouth, okay, but it's probably not okay for you to be kissing your sister on the mouth, okay. And then going out from there, where the next circle might be, people who are close to you, like teachers and coaches and ministers, casual friends, those kinds of people, and what's okay and not okay with them, versus an outer circle of strangers, and what's okay, waving, maybe shaking hands, those kinds of behaviors. But you certainly want to make sure that you're including in education about boundaries with your circles, the sexuality component, and what sexual behaviors are and are not appropriate, when, and how, and why. Developmental age difference errors. So because of difficulties with developing same-age friendships, I've already said this really, people on the spectrum may gravitate toward younger children who are less likely to reject them. So a lack of understanding about the developmental, emotional, mental differences between them and this child may lead to inappropriate, problematic, and even illegal sexual behavior that would otherwise be normative if it were engaged in with the same age friend. So education and supervision is the key. I don't think I would ever instruct a parent, do not ever allow your 14-year-old son who's on the autism spectrum to play with an 8-year-old neighbor, okay? But what I would do is say they must maintain visual supervision when that's occurring. You need to know what's going on in that play so that you can, intervene when necessary. And we'll talk about that in a minute. Because a lot of the learning needs to take place in vivo, okay? When it happens, when things occur, you need to take advantage of situations as a learning opportunity with the person. So that's where we are now, is the teaching techniques. Modeling is huge. Just as modeling can be a problem because they don't have any context. Okay, there's a kind of a concrete, literal way of interpreting things. Well, that tells you that modeling is a great way to teach. Okay, so you have to, and the other thing is later, I'm going to talk again about role plays. But when you do role plays, you should model what you are wanting before you do it, not just instruct verbally or even written, but to demonstrate how you want them to do the role play. So modeling. But modeling includes things like, for females who are on the spectrum, how to use hygiene products, tampons and pads, okay? Putting on a condom. There's a way that you put on a condom to enhance the possible effectiveness of the condom. And it's interesting because that's a skill that I think a lot of people who aren't on the spectrum don't have. Step one, look at the expiration date. Step Step 2, check to see that there's no air hole in the package. If that's been compromised, the condom's probably been compromised too. It's making sure that there aren't any tears or holes or any leakage in the condom itself. Okay. Condoms have a receptacle at the end. You should pinch that closed as you place it on your penis. Okay. Why? Because if there's air in it, the semen doesn't have anywhere to go. It's going to displace the air, and there's a possibility of breakage. Okay. So, rolling it all the way down to the base of your penis. Okay. After ejaculation occurs, it's removing your penis before it gets flaccid and the condom has a chance to maybe slip off. Okay. Removing the condom from your penis away from your partner. Okay. And where to dispose of it. You don't put them in the toilet. You put them in the trash. Okay. I mean, these are steps that all of us could really benefit from. Augmentative communication, using visuals, lots of even props, scripts. This all helps. Incidental teaching. This is what I was talking about a minute ago. When something happens, pull the person aside, not in a way that is embarrassing, humiliating, shaming, but in a way that you've already pre-planned that this is going to happen. Okay, they know that there are going to be times where they're going to be pulled aside because it's a teaching moment. Okay, and you approach it in that way, just kind of a matter-of-fact teaching moment. And then the role plays. The thing about role plays that's so important is that generalization is very difficult for most people on the spectrum. Just because you role play this situation doesn't mean they automatically will generalize it to other similar situations. Okay? So you have to be exhaustive and repetitive in your role plays and in what you're teaching so that it helps them to be able to generalize that information to various situations and settings. So guidelines for parents, educators, people who are in positions of responsibility like foster parents, social care workers, group home staff, residential treatment facilities. Some guidelines are to make sure you are educated. Okay? Educate yourself about human sexuality in general. Okay? Not just about people who are on the autism spectrum, but about human sexuality in general. Resolve your own fears, discomfort, and hang-ups about sexuality. I've had it kind of easy because my work requires me to be pretty open and frank, about things involving sexuality. But I don't think that's true for most people, unfortunately. And the very people who really need to deal with those things are parents. And that's because it is the barrier, I think, that prevents parents from talking to their kids about sex and sexual relationships and intimacy. Know your own values and beliefs. Again, some of those may be challenging to resolve. Be prepared to assert your own privacy boundaries. Okay? So when you're talking to your child, there may be an opportunity for them to misinterpret something that you're trying to teach them because maybe you forgot to set some boundaries around it, and they may cross a boundary with you. Okay? And so you have to make sure that you're prepared to assert your own boundaries. Use accurate terminology. It's not a wee-wee, okay? It's a penis, okay? It's not a vajayjay, okay? It's a vagina. They're not tits, they're breasts, okay? We need to teach appropriate language, correct language, and there's a reason for that gets left out a lot of times, and I'm going to say it now, and that is I've worked a lot with perpetrators of sexual abuse, sexual assault, sexual violence, and the ones who have taken advantage of children, especially young children, all tell me that if that child had demonstrated in any way that they knew, they had knowledge about sexuality, they probably would have backed off, okay? They know too much. And as simple things like knowing that it's a penis, knowing that it's a vagina, is enough for them to stop and think twice, okay? Kids, in school use all kinds of slang. And I don't know how effective we can be in deterring that, but we can still educate our kids about what are the technical, correct terms for our sexual anatomy and for sexual behavior. Set limits and boundaries on when, where, and with whom sexuality can be discussed, okay? So, you don't necessarily want your son or daughter just to walk up to their teacher, maybe it's their PE teacher, and ask them what what they think about oral sex, So you got to set limits and boundaries on who they can and when they can talk about it. You're open with your communication with your child. However, you don't want them to walk up to you in the middle of Walmart around other people and start asking you questions about sexuality. Okay? So be clear when discussing relationships. All right. So what I mean by that is when you're talking about those circles, okay, those social circles, if you're too specific by saying, for example, well, with Paul and Mary, then they won't generalize it. Okay, you have to say with aunts and uncles. Okay, with aunts and uncles, this is what's appropriate and this is what's not. With brothers and sisters, with peers at school, okay, with other kids at school. If you're too specific, they may not generalize it to everyone. Okay. Kind of already talked about this, but use teachable moments that arise in daily life. Take advantage of every opportunity as that, an opportunity. Be honest when asked questions. Be honest if you don't know the answer. It's okay to say, you know what, that's a great question. I don't know the answer to that. Let's look it up together. But be honest. You can be honest. It's okay. Validate feelings while setting limits and boundaries. Okay? There may be a tendency, and I think a lot of parents have a tendency, to focus on the behavior, and in addressing the behavior, they aren't taking into consideration what the child is feeling at that time. You have to validate their feelings while also correcting behavior. Okay? I can see that you're very angry right now, and I think that because this is what happened, it's normal to feel angry. However, it's not okay for you to break your brother's toys, okay? Or it's not okay to punch a hole in the wall. Okay? That means now we have to go and hire a contractor to come and pay all this money to replace this, sheetrock, and then we have to paint it. It's expensive and it's a lot of work. It's not okay to destroy property. Okay? And then you can talk more about, okay, but let's now talk about what you do when you're angry. What is it okay for you to do when you are angry? Teach. And again, repetition. You gotta have a lot of patience. Be proactive. Don't wait for them to come to you. You go to them. Be positive. Be brief, to the point, and be factual. Provide information at their level of understanding using their preferred communication style. One other thing I want to point out as I'm talking about this, because I don't think I put it in the slide in any place, but because of some of the features of concrete literal thinking that can be present, one of the things that can happen is when you're trying to explain a behavior and giving reasons for doing something or not doing something, you really don't have very clear, specific reasons to explain it, they're not going to get it. Okay, you're really not going to get it. You know, for a lot of people on the spectrum, the subtle kind of nuances of social expectations kind of get lost. They don't understand them. You know, the classic example is just with chit chat. Okay, a lot of people on the spectrum do not understand what the point is of chit chat. Okay, casual talk about the weather kind of chit chat. It's stupid. Okay, I mean that's kind of how it gets processed. And you know what? They got a point. Really, they're kind of right that it's meaningless. It's pointless. Really, I mean, why? None of this matters. Okay, you're just chit chatting, right? It's a social kind of expectation. It's a way to start conversations, to get to, you know, things that do matter more. So, you know, when you're explaining the reasons for things, you really better know how to explain it in a way that will make sense, okay? And have evidence for it. I don't know, maybe I shouldn't say this, but it kind of goes back to values and beliefs and the influence of culture and even religion. You know, there's a disproportionate percentage of people on the autism spectrum as adults who don't believe in God compared to the general population. And the reason why is because they can't find and no one can give them any evidence that there is a God. Okay, so if you want to, you know, I mean, that's just a reality, you know. So this is where I kind of pulled together a lot of information. I'm sure that there's some missing references, but all of this is just readily available on the internet. I don't claim to be an expert on this. I am kind of an expert when it comes to problematic sexual behavior. However, I have to constantly read and educate myself, okay? Because nobody can be an expert in everything, okay? And so, you know, take advantage of the resources that are out there. And there are a lot of wonderful resources in other countries. You know, I think like this was from a conference, but if you type in that, it'll come up. You know, this is from Queensland, so that's
New Zealand?
New Zealand, I think, or is it Australia?
Yeah.
One of the two. You know, but and of course, seek us here for just general learning about human sexuality, how to develop curriculum. They even have curriculum ready that you can use. So now, so this is my contact information. I was going to bring business cards, but I ordered new business cards and they didn't arrive. So actually they did, but I wasn't at the office and it was UPS, so they couldn't leave them. So I have to go pick them up on Monday. I will tell you this too. I mean, I'm available, especially in regards to working with, you know, pubescent, prepubescent, pubescent, you know, and post-pubescent kids, and being able to help with this particular area in terms of developing healthy sexuality. But I'm new to the area, actually. We moved here a year and a half ago from Washington State. So in Washington, I was kind of the go-to person in the community to whenever there was someone who came to the attention of Child and Family Services or the courts when they were on the autism spectrum and there were some problematic or even illegal sexual behaviors. I'm who everybody wanted to evaluate those kids. I'm who everybody wanted to send them to for treatment. But when I came here, I took over a practice. So I don't have any clients right now that are juveniles who are on the autism spectrum. I do have a couple of adults that I'm working with. But this is certainly an area where I'm interested in expanding my practice. But I'm also aware that here in the Tampa Bay area, there are some tremendous resources here. And Florida State University, up the highway, up the interstate there, there's a lot of research and everything that's been done there. So this is a resource-rich area here in the Tampa Bay area, it seems, from what I can tell. So I'm looking forward to taking advantage of that myself. Are there any questions?
When you mentioned Florida State, you mean USF, University of South Florida? Because you're up the street and you'll be USF, Florida State is in Tallahassee all the way.
Well, yeah, up the interstate. Some of the research that I read was actually done at Florida State University. There may be some at USF as well, but I just some of what I read that kind of comes to mind is out of Florida State.
Just a comment. I have a 14-year-old son, and I've always told him you can have a girlfriend when you have a job and a car and this and that. When you're 32. And anyway, around Christmas time, a young lady knocked on our door, presented herself as his girlfriend, and I was a little taken aback by that, but I was polite, and he went outside and played basketball with the girl. Anyway, I told him, you could be friends. I don't think Xavier can have a girlfriend yet. And then I realized the minute I said it was a long thing. So 2 days later, I said, well, you should probably get her something for Christmas. So we went shopping and I got a little something on the card. And then I used it, as you were saying, as a teachable moment and started calling her his girlfriend because while I was denying it, there was no teaching going on. So it ended up being a good teachable moment.
Excellent.
He didn't want to hear anything I had to say to him, but.
Well, and that raises one of the main issues too, right? Because he's probably around a lot of kids his age. Well, a lot of kids his age have boyfriends, girlfriends. And the more limitations you place from normative kind of social opportunities, the more ostracized and stigmatized they feel. So it's a challenge, no doubt, but you really have to, that's why it's so important to start early. There are guidelines at the SECUS website in terms of what kinds of things to teach at what ages. And really for people on the spectrum, it's no different. Okay, it's no different in terms of when you teach what. It's just how you do it. It is going to probably be different. So, anything else?
The other thing is the same child, he's 14 and I have a 10-year-old. And I've always called him a friend stealer because the 10-year-old makes friends and the 14-year-old steals them. And I guess I kind of get that they look up to him because he's the big one. So while he hasn't made a lot of his own friends, he always steals the ones that come over.
And again, that's normal, right? Younger kids really feed off attention from older kids, especially at that age. If that's your only opportunity to have friends, you're going to take advantage of that. You just have to be aware of the potential for there to be some problems and safeguard against that. Okay. Well, thank you.
Thank you so much. Appreciate it. I was going to show you the books that we have.
I haven't seen this. Now, is this done by